For the lumbar extension exercise, we're going to have the patient starting with a wall behind them in case they feel like they're going to fall over. They're going to start with their legs, their feet shoulder width apart, and their hands are going to be on their hips. They want to tilt their pelvis until their fingers are in line with each other or tucking their tail. We're going to ask the patient to lean back as far as they can, pain-free. The wall is there for reassurance, but also can be used to see how far they can lean back and then come back forward. This should be done for at least 4 to 5 reps continuously to have that pain centralize in that lumbar extension, but also improve their flexibility and their range of motion. As the patient gets better with this throughout the week, we can improve how far they are from away from the wall. But again, the patient should not be knee driving or knee bending, causing to that extension. It should come solely from their lumbar. For the hamstring tensioner, we're going to have the patient started with seated. Their head is going to be in a neutral and their chest is going to be in a neutral. They're going to kick their leg out and point their toes up towards them. They're then going to flex their toes down and bend their knee. For the two-sided tensioner, we're going to have the patient now flex forward and bend their chin down. So we're going to have the patient kick their leg out, point their toes up towards them, then they're going to lean forward and tuck their chin. Extend their chin, lean backwards, bend their knee, and point their toes back down. For the Superman exercise, we can have the patient lying on their stomach. Arms are going to be out and their toes are going to be pointed against them. They're going to start with their head facing down, and we'll ask the patient to lift their arms and legs up off of the ground and sustain a hold for as long as they can, lowering back down slowly. They should be squeezing their glutes and bracing their core throughout this exercise. They should do this for about 12 to 15 repetitions. Since our patient typically engages in deadlifting and the force activity forward, we want to make sure that the patient is maintaining core stabilization, but also we are working on posterior chain endurance and making sure that we are able to balance out throughout the exercises that they're doing, but also in their activity. So what we'll start off with in our follow-up care plan, once the patient's symptoms are starting to resolve and we start doing more strengthening, once we start deadlifting, we want to do a light weight on the bar, typically around 20 to 30% of what their max 1RM is, and what they will be able to sustain for about 20 plus seconds holding. So we'll ask them to get into their stance, whether it be a sumo, wide stance, or a conventional deadlift. We'll have them get down into the position. What we'll do is we'll ask the patient to engage their lats and pull the slack out of the bar, pushing through their midfoot. We also want to make sure that their core is embraced throughout. From this position, we're going to ask the patient to continue to hold it until they begin to lose that endurance and then reset. We'll then ask the patient again to take the slack out of the bar, squeeze their lats, brace their core, and push through that midfoot, again maintaining that neutral spine, pushing through their glutes, down their midfoot, maintaining that lat contraction throughout. Once this patient can show that they can do that for a given amount of time and they have no pain, no difficulty, we can then start adding more reps, higher weight, or even increasing the speed. We want to make sure that they're continuing to brace their core, push through that midfoot, making sure their lats are engaged throughout, and that they are doing the movement correctly and safely. For the prone push-up exercise, we're going to have the patient started prone, lying on their stomach. Their hands are going to be directly underneath their shoulders, and they're going to push themselves off the ground, maintaining their hips on the ground the entire time, maintaining contact. They're going to take a deep breath in, and on out, they're going to lift their chest up, maintaining that contraction, slowly lowering back down. They should repeat this for at least 4 to 5 reps and continue throughout the day, several sets, 3 to 5 sets throughout. We're going to start with the cat in the quadruped position. We're going to ask the patient to be in neutral spine, so tuck their pelvis, making sure their spine is in a straight line. We're going to ask the patient to take a deep breath in, and as they breathe out, they're going to tuck their tail up, pushing their butt up towards the air, lifting their head and neck up towards the ceiling, and then returning back to that neutral spine. We want to limit how much flexion they do, as flexion causes pain. So we're going to be focusing just on the extension part of this exercise. They would complete this for about at least 4 to 5 reps for about 3 to 5 glute bridge exercise. We're going to have the patient start bend lat on their back. Their feet are going to be underneath their knees and their hips are going to be placed on the ground. We want to make sure we have that neutral spine alignment, so tucking their tail, bracing their core, acting as if someone's going to punch them or they're pushing into a balloon. They're going to contract their glutes, and they're going to lift off the ground, pushing through their midfoot and down through the middle of their foot. They should hold this contraction for about 5 seconds, and then slowly lower back towards the ground. They would complete this set of exercises for about 12 to 15 reps, working on the bird dog exercise with weight. We're going to be working on endurance and postural control. So we're going to have the patient get into their regular quadruped position. We're going to have the weight in the one individual's arm. They're going to, again, make sure they're in pelvic alignment and neutral spine. They're going to brace their core, and with the opposite arm and leg, they're going to push the weight out and extend their leg up, maintaining neutral spine, core alignment, and making sure their glute is contracting while holding the weight in this arm. They should hold it for about 5 to 10 seconds and then slowly return back to their quadruped position. They should complete this for about 12 to 15 reps or until they couldn't go any longer. Again, we want to work on postural alignment and posterior chain endurance.